Education is the best medicine. And thanks for watching. And we want to know that we want to understand that Believe Radio is your best bet. I wanted to say thank everyone for tuning in, particularly last week. We had a lot of folks come on, and we'll try to keep the content such that you do want to listen and come on and interact and enjoy. So I'm going to try to switch it up. We've been talking a little bit about gastrointestinal problems. And again, as I said before, these are by no means medical advice. You should always check with your medical provider or your clinician in regards to any healthcare decisions that you make. This is purely informational. Wanted to say again, thank you for viewing us, and tell a friend. We hope to continue to start and follow some content that you'll enjoy and hope you get interactive. Like, although this is a gastrointestinal show, I was just thinking things that make my stomach hurt, make me nauseated, make me feel bloated, gaseous, make me have like constipation, even some rectal bleed. So these are the common symptomatology of folks with gastrointestinal issues. Uh, but just the mere fact, not even forget the nausea or the vomiting or the diarrhea. These are common complaints. These are common gastrointestinal complaints. And as I reviewed Barbara Bates, which was the book that I learned physical exam from, and it's now done. Maybe this must be the 10th or 12th uh, reissuing of the book in constant advancing. So again, it's the art of the physical exam. This is how we make diagnosis. This is how we treat people. So it makes sense. But I was reading. First of all, I want to give a real kudos out to Liz Cheney. Uh, she's a true American and someone we should listen to, regardless of our political affiliation, because she speaks truth to power. And I will constantly have this refrain in my program until it changes. We're now living in a time where the lie is the truth and the truth's a lie. I'll say that again. We're living in a time where the lie is the truth and the truth's a lie. And particular attempts to rewrite history or just ignore it or say it doesn't count. It's not important for us to listen to. This is what we want you to listen to. Totalitarian, I guess, or myopic in focus, and it's has a direct discussion around people's healthcare decision and their ability and their right to have dominion over their own body. Um, that being said, we have to do our uh, announcement. We're Believe Radio. It's a 24-hour inspirational gospel music channel. The This is the I work under the umbrella of the Eyes of the Conscious Soul with Miss Barbara Howard, who is again doing some educational training stuff, and that's great. She's getting her AA this year, so it's good stuff. And Sister B Mello, she's the first Saturday month from 2 o'clock to 3 o'clock, and then they have a Cafe La Blue Lounge with the corner. In the first corner is the artist talk. The second corner is Why I Dream, and the third corner is She Who Believes Takes Off the Mask. Interesting. Check her out. She's been getting some very, very good rating information. She brings a number of guests that we'll start to do pretty soon. On Zoom through, working folks around the schedule. Second Saturday of the month is from 2 o'clock to 3 o'clock. That's the medicine hour. That's myself and Miss Howard. I'm George Pearson. I'm a physician assistant. I have a Bachelor of Science in Organizational Behavior. Been practicing about 35 years and currently doing clinical care in a psychiatric setting. In the medicine, this is where we believe building a better tomorrow starts with us. The topics cover our health issues and concerns, health eating habits, education, financing, politics, and the African American community. And the third Saturday is this is the third Saturday, which we're in now. And the last Saturday is the kitchen table, hosted by Ms. Hard from 2 o'clock to 3 o'clock. Please tune in, give us a hear and a ear and a share. So I thought it was kind of interesting uh, as I was kind of getting ready for the show, talking about GI problems, and then I just gave you the multitude of issues in terms of, and as we talked last week about, the GI tract starting up in the mouth and ending in at the rectum, and again, a number of physiological, physical, chemical, mechanical processes in order for you to eat food, digest it, and to use it for energy as well as evacuate it. But this article caught my eye, and I wanted to kind of share with folks and see what they think about it. It says that therapists slam for using lonely men need to step up in dating from new times. And I said to myself, where is Alan Alda? And if you don't, again, I'm dating myself. Alan Alda was an actor who his one of his famous roles was in a Doctor in MASH, but he also was thought to be one of the sensitive, caring, understanding, listening men that men need to model after. And you know, we'll see how that happens. So it says that dating opportunities for heterosexual men are diminishing as relationship standards rise, a new report claimed. Couples psychologist Dr. Greg Malos penned a piece uh, titled "The Rise of Lonely Single Men," in which he argues men need to address their relationship with skill deficits and um, as women are becoming increasingly selective. And it was noted that this is a recurring theme um, from women between the ages 25 and 45, and he wrote in a piece in Psychology Today. In Psychology, excuse me. He says, the women that were surveyed preferred men who were emotionally available, good communicators, and share similar values. Uh, Mr. Matos said that there were the three reasons men were having trouble finding partners, citing the rising use of dating apps, increasing relationship standards, and the failure by guys to step it up. I want to pause there because I want to know what people think about that. And if you're dating, if you're not dating, if you're engaged in a relationship, if you're not engaged in a relationship, the quality of the individuals, the level of education, their ability to, access or not access funds. And the reason why I bring this up is that I have four girls who are getting to be teenagers, my great granddaughters, my great granddaughter, my granddaughters. And I'm wondering what kind of world they're going to be in when the men that they're meeting, and this is again, I have to preface this by saying this is for white men. They are discussing this. The survey was probably, although it doesn't say, done on white women for white men. I'd be interested in the ratio, but the bottom line is that if it's tough for white men, then what's going on with men of color? What's going on with African men of color, Hispanic men of color, Asian men of color? If you're not meeting that standard, and I was just listening to some of the music because I try to kind of stay up with some of these things, and what my granddaughter told me. She said, "Granddad, when men were talking about women's bodies, it was okay. Now that women are talking about their bodies and making money, it's not okay." Couldn't argue with her about that. So I'll be interested. Again, it's you can look up the article. It says, and the reason why I brought it because the therapist got slammed and threatened on his webpage. You know, threatened violence against him and all this kind of stuff just because he was saying that men need to step their game up. Well, maybe we do. Um, he also said the relationship gap that is not addressed will likely lead to fewer dating opportunities, less patience for pure communication skills, and longer periods of being single. Problems is that emotional connection is the lifeblood of healthy long-term love. In other words, can we be sensitive as men? Can we be loving as men? Um, can we listen as men? Well, I don't know if the thing I want to offer is taking away a woman's right to decide whether she wants to have a child or not. Then, boy, that kind of just checks all the boxes off as lack of communication, lack of listening, lack of everything. Um, and this was a 2020 study. It found loneliness was greater in men than in women, and 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 boy, did he take a hit. And then they were calling them, and it says why women weren't shocked. They had been complaining about how the bar is set for years. Many men are outraged, urging women are too picky, have double standards. What do you guys think about that? Is that true? Is it not true? Because in reality, our relationships have to do with how we digest food, how we eat, what we eat, you know, whether we want to eat or not. Okay, so plays a role. And what happened was that Mr. Mados started receiving hate mail from men as a result of the article. So the question is, don't blame the messenger, blame the message. And the men that are responding to him in such a negative manner, should they kind of be looking at themselves, or is it that it's my way or the highway? I don't know. Uh, he said it found that men are more likely than women to be unpartnered, which wasn't the case 30 years ago. So in other words, you know, gets into this whole thing about relationships and what you have to do, how you have to work together, or your partner, or your friends. Can you support in a time of need? Can you understand that, boy, I don't feel good and I'm sick and I'm kind of tired and, I'm just not feeling it, and understand that, you know, or do you take it personal? And I guess over my 60 years, 67 years, some mix of both, you know. So it's just a way of looking at things. It's like, what do you want? Well, the question is again, if it's status and money, is that the issue? Because if that's the issue, then yeah, we've got a problem. Because everybody's not going to make. I was, believe it or not, I was watching uh, Steve Harvey, and he does his show, Family Feud. So one of the questions asked, what was one of the um, factors in a no for a guy? And the discussion was if he made less than $500,000 a year. $500,000. So there are women in this survey that feel if you're not making $500,000, you can't talk to me. Well, you listen to the music, the women are saying the same, young girls are saying the same thing. So now, how does that change the trajectory? Is it okay to? I was working out yesterday with a group of men, and one posed a question about whether it was okay to pay for intimacy. And the kind of conclusion was in one way you were going to pay for it or you weren't going to pay for it, would be dinner and flowers and diamonds or whether, straight out cash. So again, I was talking, we were all working out and one of the young brothers said that, he personally like to uh, take care of everything when he went on a date because it was just easier for him. Some guys got it. So the basically women are saying that the bar for men is really really low. So the bar for straight men is literally ground, and they still tone underneath it. Another comment. These are the women saying. So one while one remark, I guess the bare minimum in misogyny isn't working out, huh? So again, misogyny is when male macho super guy, right? Say men have key roles in this transformation, but only if they go all in. It's going to take that kind of commitment to themselves, to their own mental health, to the kind of love they want to generate in this world. He wrote before adding, "Will and can we step up?" Food for thought. Uh, and there were some interesting comments. Uh, post the article, read it. I think it's interesting. Um, so now to the GI issues. And if that didn't make your stomach kind of turn and feel kind of, then I don't know what will. So, asked about common symptoms of gastrointestinal diseases, and some of the common problems are abdominal discomfort, bloating, pain, cramps, difficulty swallowing, and vomiting blood or stool. And if these are the cases, you really need to seek your provider. You should seek your provider anyway, just to go. So, um, so I looked at common digestive diseases. The prevalence is about 60 to 70 million. And when we talk about digestive diseases, we're talking about gastritis, peptic ulcer, irritable bowel syndrome, reflux, diarrheal issues. Yeah, and primary diagnosis in the office was like 36.6 million. Uh, Primary diagnosis in the emergency room was 7.9 million. So GI make up, quite a bit of one visits to the office, visits to the ER, and it's a primary diagnosis in about 3.8 million. It's responsible for about, in terms of hospitalizations, about 21.7 million, and it it's about 12% in terms of diagnostic and therapeutic inpatient procedures. It's about 12% of all inpatient procedures. That's like colonoscopies, endoscopies, those kinds of things. Interventional radiology, and uh, the in ambulatory surgical procedures, 20% of all write-in surgical procedures. 20%. That's a lot. Again, these are a lot. So GI issues play a major toll on folks in the U.S. It costs about 141.8 billion. This was in 2004. The pandemic, all this stuff has made it worse. And one of the most common discussions was chronic constipation. 63 million people have an issue with chronic constipation, and we'll talk about the definitions. But yeah, chronic constipation. 63 million people. Ambulatory visits was 4 million. This is 2009. Also, what I like to note is mortality, 132 deaths, and use of prescriptions for cause constipation or treated constipation. Secondly, is hemorrhoids. 75% of people older than 45 have had a history of hemorrhoids. 75% of people older than 45 have had experience with hemorrhoids. It accounts for ambulatory visits 1.1 million, and hospitalizations. Hospitalizations, for removal of the hemorrhoids, and because sometimes they're bleeding, and they're painful. So surgical intervention to treat them. GERD, reflux, says something like 20% of the population has an issue with gastric esophageal reflux. This is where acid in your stomach, uh, and there's a protective layer of mucus around the stomach, and there's also the what's called the lower esophageal sphincter. This keeps the acid in the stomach. You chew food, take the bolus of food, swallow it down your throat, and again, we'll talk about some of the things that are a concern if there's painful swallowing or feeling like the food stuck. But it travels down and it creates, and all these enzymes are providing enzyme, the pancreatic enzyme, the bile from the gallbladder enzyme to help with digestion. All these issues come together. They create almost what's called a mix as a bolus called chyme. It goes into the stomach, and the lower esophageal sphincter at that point should compress so that the hydrochloric acid and the contents of digestion don't shoot back into the esophagus, which can cause injury and pain. And so, again, 20% of the population. Uh, and we'll talk about some things to do, like sitting up, don't eat an hour before sleep, watch sodas, watch tobacco, watch coffee. If you're using those things, I drink coffee, but watch tobacco, watch alcohol seem to be really major issues in terms of causing a lot of gastrointestinal issues. So a lot of this has to do with prevention. Plant-based diet. Get tired of me talking about it. Plant-based diet, more water, more exercise. Relaxation technique. All that helps with digestion. Irritable bowel. Again, irritable bowel is 15.3 million people, and it is responsible for 1.6 million hospitalizations. Excuse me, 1.6 million ambulatory visits, and almost 208,000 hospitalizations. And again, these are all the things that are the most common and are uh, usually have a good outcome unless there's an issue. But again, you always have to be aware of, although these are common, stuff like vomiting blood, uh, uh, hematemesis, uh, when you're eating your food, either it's sticking or not going down completely, autophagia and dysphagia. Again, these are things that should be concerns to you. And there's also a correlation between gastrointestinal issues and, believe it or not, heart attack and stroke. So epigastric pain can mimic cardiac pain. So it's something you have to be evaluated for. That's why you need to stay in good stead with your common primary provider and understand the signs and symptoms of heart attack, stroke, angina versus GI issues. Um, Also, liver disease, hepatitis B, hepatitis A, B, and C. Uh, and prevalence is about 3.3 million. Ambulatory visits, like almost 635,000. Usually, endpoint most liver disease, if it's causing issues, is cirrhosis, usually alcohol or chemical exposure, and sometimes genetic. Uh, the hospitalizations, again, 1.2 million. And I bring up hepatitis because there's great treatments for it. The great treatments for it, hepatitis A you can do anything about, but B and C, and I am in that age group. I'm in my 60s, around 50 on in my age group, and then the baby boomers was a lot of drug use and a lot of unprotected sex. So this resulted in a lot of cases of hepatitis B and C. Also, a lot of intravenous drug use for some reason. Um, that caused the virus to spread. Again, but they're great treatments for it. They even got treatments that maybe go anywhere between 6 weeks and 6 months. to totally resolve the hepatitis in your system. Some look at pancreatitis, 1.1 million. Acute cases is 17 per 100,000. And usually, again, usually of a chemical nature, acute pancreatitis, usually from alcohol or drugs or both. Um, Food can, but not as much. Usually something consistently inflammatory. And peptigosis disease, also in the peptic region of the stomach. Again, 15.5 million prevalence. Ambulatory visits, again, about 669,000. Hospitalization, over 300,000. Again, risk from bleeding to death for the ulcers not treated uh, is something like 2,000 deaths. And large number of prescriptions to medicine prescriptions. Um, According to the data from the U.S. Census Bureau, 45 to 50 million people older than age 65 years have one gastrointestinal complaint that impacted their daily life and that could result in a medical visit. GI symptoms are common in older adults and range from mild self-limiting episodes of constipation or acid reflux to life-threatening episodes of infection. And so I went back to, I guess I went back to school. I'm always going back to school. And I wanted to see how the GI setting was when I first entered school and was handed the Bates Guide to Physical Exam, and it was currently reviewed by Lynn Bechtel, I guess in the last 5 or 6 years. They may have a more updated version, but it basically talked about, understanding, well, basically they talked about the areas of the abdomen and in dividing the abdomen into quadrants. And so we have the sigmoid colon in the left lower. It's a small tube, and in the left lower quadrant. The ascending colon is in the right lower quadrant, and the transfer and descending colon were, you just couldn't fill them on exam. The right upper quadrant, possible to fill the small edge of the liver, because it's important to understand that, again, it's not just the symptomatology when you're seeing a clinician, and this time understanding the areas that of concern and how and why you hurt, because that's how we address the problem. Um, and um, and for the most part, it's onset of the issue, location, duration, what makes it better, what makes it worse, any prior episodes, always historical. Um, and the I kind of started to understand that again, always the history is always the most important, and it started me to kind of put this talk together. And I want folks to kind of understand that GI issues involve a change in the environment that decreases the protection and increases the exposure to the irritant. So if I have to use alcohol, tobacco, uh, from the mouth down to the throat, irritate, cause changes in the tissues that can change how you're able to eat, swallow, digest food. Dentation is really important, right, in terms of eating. And as we age, there's been less of a it shouldn't be. There's been less of a discussion around dental care and dental issues. Again, it's how we eat, it's how we chew our food, it's how the enzymes get started, from the mastication, the chewing of the food, and the swallowing of the food, mechanical. Um, and it posed in the Bates book, it said the first question was asked is, how's your appetite? Yeah, how are you eating? Um, what are you eating? What you like about eating? Are you feeling eating more or less? Are you gaining weight, losing weight? Uh, that gets you into a discussion about not only the person but their environment and how do you get your food? Are you able to go and pay what you want for your food, or are you on WIC, or are you on general assistance, or you have a fixed income? Because within that concept, there's only so much food and types of foods you can buy. And if those foods are high in fat, high in salt, high in sugar, uh, they're hard to eat and digest because of the processing. Uh, and so the list that they had, and I'll start going through the first list question was indigestion. And how they define it is indigestion is also called dyspepsia or upset stomach. Um, and again, it's a discomfort in the upper abdomen. If you cut the abdomen into quadrants, and use the umbilicus as one of the starting point. There's the epigastric above the umbilicus, and the or belly button, and the hypogastric, which is below the umbilicus. Um, and indigestion is described as certain symptoms such as abdominal pain and feeling of fullness soon after they start eating. The person starts eating, and later, rather than a specific disease. So, what I thought about reviewing this is that how much, I mean, the biggest thing I think is interesting is stretch of the stomach, stretch of the esophagus to accommodate those large boluses of food. I think it's always unique that your body works in a way that it not only takes the food in, that when you chew and swallow it, it starts to accommodate the size of the food and as it's shrinking it down and breaking it down to its smallest components for you to absorb till it gets to your stomach. That's unique. And if anything along that line is not right, in other words, if you don't have the ability for through a thing called motility or peristalsis to move that food down to your stomach, then it gets stuck. Or if something's sticking in, or if there's a blockage there. I just, just um, uh, and it can, the discussion around this is also the stretch and bending, and again, and what products might cause problems like alcohol, citrus, and aspirin. Um, Excessive gas or belching is again a result of or distension or stretch, right? And again, it's back to where the lower esophageal sphincter, if it is not competent, then again, gas and products of digestion and the gas given off by that escape. Um, and so belching, abdominal bloating, very common, and distension. But again, stretch. I always think about Stretch Armstrong in terms of stretching. And gas, aerophagia, belching, and the thing, again, the concept is around increased use of legumes or beans and other gas-producing foods. And some people have intestinal lactase deficiencies, and it's one of the most common selective issues in terms of carbohydrate absorption. Most individuals, except those of northern European descent, begin to lose lactate activity by the age of 2 years. In other words, we can't ingest milk products. And if we do, and so the prevalence of lactase deficiency is highest in 85 to 100% of persons of Asian, African, and Native American descent. So if you're wondering why when you drink milk, you have gas and you're bloated, it's because you don't have the enzyme to break it down. And so it's a lactate deficiency. It says that in some of the clinical manifestations, adults with lactate deficiency typically complain of gas, bloating, and diarrhea after ingestion of milk and dietary products, but do not lose weight. And why is that significant? Because um, in cancers, you lose weight. In GI cancers, you lose weight. In pancreatitis, you can lose weight. Um, and gastric outlet syndrome, which is a blockage, right? of the gastric outlet. Again, the esophagus travels down, attaches to the stomach, the lower esophageal sphincter, and again, gastric tone. Irritable bowel is a common disorder that affects the large intestines. So we have a large intestine and small intestine, right? And believe it or not, the small intestine is larger than the large intestine. Uh, again, the food travels through the small intestine, gets processed, and then uh, it is attached. These are the duodenum, which is in part, duodenum cecum, to process the food into the large intestine, where it is processed and the nutrients are taken out in the ascending, descending, and ascending colon. And then you, at the end of that process, in the rectum, you form stool. Again, now, again, from the mouth to the anus, if anything goes wrong, you could have a problem in terms of GI issues, either coming in or leaving. Uh, so irritable bowel syndrome is a common disorder that affects large intestine. And signs include cramping, abdominal pain, bloating, gas, diarrhea, or constipation, or both. Irritable bowel is chronic, and you need to manage it for the long term. Uh, Only a small number of people with irritable bowel have severe signs and symptoms. Some people can control their symptoms managing diet, lifestyle, stress, and that is for all of this. All of it has to be managed by diet, lifestyle, stress, exercise. More, and that's the lifestyle, right? More severe symptoms can be treated with medication and counseling. But if you can handle what you're consuming, handle the amount of what you're consuming, handle the time that you're eating it, and handle what you're eating, you'll probably have a better uh, benefit and able to minimize GI issues. Um, and Irritable doesn't cause changes in the tissue or increase your risk of colon cancer either. So this is one of the good things about that if you have irritable bowel diagnosis, then it's highly unlikely you'll get cancer. Abdominal fullness after meal or early sanctity is a or inability to eat a full meal. Now, as again I said before, some of the issues have to do with the amount of food we're eating and what we're eating. So if you're picking a meal that's high in citrus, high in foods that are gassy, beans, then you can expect to have a fullness in your stomach and that kind of thing because it takes longer to break these products down and they're just normally gaseous or normally space occupying. Um, uh, One of the other concerns and discussions around is diabetic gastroparesis. And gastroparesis is characterized by delayed gastric emptying in the absence of a mechanical obstruction. That's what diabetes does because of blood sugar elevations. It slows your ability to uh, uh, empty your gastric contents. So it comes in, but it has a problem getting out. And diabetes, a common cause of gastroparesis. Diabetes gastroparesis has been associated with symptoms such as nausea, vomiting, early sanctity, bloating, post-meal fullness. That means fullness after you eat, abdominal pain, and weight changes. Again, these are some of the issues. Um, um, and some medicines can cause GI disturbance. Anticholinergic drugs. These are drugs that block the colon and they work by inhibiting. There's two symptoms: the sympathetic system and the parasympathetic nervous system. And the parasympathetic system is responsible for automatic uh, automatic functions. These are what I think about like tears, saliva, and feelings of a full bladder. And doctors prescribe these particular drugs for urine incontinence, lung diseases, and cholinergic toxicity. They also use during initiation of maintenance of anesthesia surgery, and they also have Parkinson. But again, it can cause GI issues, and it's things that you're mindful of. Um, Red flag, gastric outlet obstruction with weight loss. Gastric outlet obstruction is a result of a disease process that causes mechanical impediment. So that means that the food can't flow through as well as it would, and it gets full backed up. It can cause by a mechanical cause or motility disorders. Remember, we need to have peristalsis throughout the GI system from the mouth to the anus to move products through the system and out. If that's impeded or changed by drugs or disease, then it's less likely to happen. And the gastric outlet is always associated, usually associated with abdominal pain, and again, post-prandial vomiting, early sanctity, and weight loss. The activity reviews, well, again, and again, once these things are going, you really want to see a provider, be evaluated, and they will do studies as well as ultrasounds, as well as probably upper lower GI series, and in some cases CT MRI for treatment. Um, in the GI tract, one of the issues is gastric cancer. It develops in the inner of the stomach, causes bloating, stomach pain, difficulty, swallowing, nausea, vomiting, fatigue, and again, weight loss. Weight loss is always a key concern in GI issues. Um, it's always a concern because I'd say weight loss, rectal bleeding, vomiting up blood, um, unchecked diarrhea, all those things are things you need to have evaluated. You can't wait. It's not going to probably get better. Uh, and talked about early sanctity and uh, talked about early sanctity and early sanctity means that you eat, you just get full. Commonly in hepatitis, or you just don't feel like eating anorexia. We know about the disease, but this is just people just don't feel like they want to eat. They're not trying to not eat to get skinny because they have a body dysmorphia image. Nausea is sickness in the stomach and urge to vomit. Vomiting, yeah, can have an effect of lower potassium as well as what's called metabolic alkalosis. In other words, consistent vomiting changes your chemical mixture and your dynamic. Again, you feel sick. And severe vomiting can increase the abdominal tension and make your stomach swollen too. So, some of the issues around nausea and vomiting have to do with pregnancy, diabetic ketoacidosis, which is the end stage where a person hasn't had not enough insulin and he starts to break down fat, and the body tries to process it, but it's not a good energy source. Adrenal insufficiency, elevated calcium, uh, chronic liver disease, emotional states, adverse drug reactions. Um, Again, it's the mouth to the anus, and the body is uh, separated in quadrants. Stomach. Uh, and heartburn suggests a reflux of gastric acid or hydrochloric acid to the esophagus, and the GI tract of the mouth again runs from the mouth to the anus. Is in the upper part of the GI tract, uh, and digestion occurs uh, uh, in throughout the GI tract because the mouth, as you chew your food, you mix the food and develops into chyme and travels down the esophagus vis-a-vis peristalsis through the stomach, and when it reaches the area of the lower sphincter after getting um, digestion help from the gallbladder as well as the pancreas. Um, uh, then it goes and chimes down the stomach, process the lower esophageal sphincter. If competent, squeezes, but if not competent, it opens or allows fluid to flip back into the esophagus as well as into the upper part of the throat, and this can cause conditions like Barrett's, which is a precancerous issue from the lower part of the esophagus being exposed to hydrochloric acid and alcohol. Um, and again, uh, the issue with this particular condition is that the acid retrogrades back into the esophagus and causes burning, and, and, and it can travel down to the stomach. It can contract the stomach, and it's almost a back and forth motion. And it causes epigastric pain. We talked about the umbilicus as the uh, roadmap above the umbilicus, the epigastric area, which is to be the pain, almost between the ribs, and it can cause a lot of problems. The big thing about this is you don't want to confuse it with cardiac pain. Chest pain or angina tends to increase with activity and decrease with rest, versus heartburn is worse after meals and lying down. And again, you have to be a heart disease in general. Nausea is a sickness of the stomach, urge to vomit. Nausea is uncontrolled feeling in the back of the throat and the chest, and the top of the stomach. It may be accompanied by aversion to eating and urge to vomit. In addition, uh, nausea, you have a finding, you should contact the health provider. Vomiting, regurgitating material sometimes is a part of the issue again. And odor, uh, uh, normal gastric juice is clear and mucoid, but if you start to get brown or black vomits or coffee grounds, that is a concern that you need to have evaluated. Uh, 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 some of the common causes of vomiting blood are ulcer, esophageal varices, and tears in the esophagus. And peptidosis is very common. It's a burn in the stomach, filling the forms, bloating, vomiting blood, weight loss. Uh, Esophageal varices is from alcohol use or from swelling of the esophagus, usually from alcohol and tobacco. Abnormal dilated veins in the esophagus. Um, uh, yeah, food pipe. Food pipe. It connects to the throat and stomach. Usually develops when the uh, blood to the liver is obstructed by clot or scarring of liver tissue. The symptoms may be pain in the abdomen, vomiting blood, black tarry stools. Again, these are all issues that need to be addressed and evaluated. These are things that can't wait because they're symptomatic and serious. And also tears in the esophagus, seen that from coughing, from trauma, um, those kinds of things. And vomiting retching can cause a tear in the esophagus and some bleeding, the sharp pain in the lower chest, and you have trouble swallowing also, the dysphagia or aphasia. Uh, duodenal ulcer are usually small erosions. What we're doing, we're traveling down the GI tract. We went from the esophagus and now we're in the stomach uh, to discuss the areas and the conditions, and again, red flags, and just in general, these are things that are going to be hard for you to manage on your own or with over-the-counter medicines. You probably need to see somebody. Duodenal ulcers are small holes or erosions that occur in the lining of your duodenum. So providers can have a plan. You can discuss a plan that want to alleviate or reduce the impact of the condition on your life, as well as save you some time and money from going to the ER or that in the middle of the night. And a lot of things happen in the ER. You just, if you can avoid it. Avoid it. If you gotta go, you gotta go. Are small holes or erosions that occur in the lining of the duodenum, which is the first part of your small intestines, immediately beyond the stomach. Duodenal ulcer is a type of peptic ulcer. The other type of peptic is a stomach gastric ulcer. This occurs in your stomach. So just imagine these two ulcers bleeding together, causing problems. So it'd be bad enough to have one, but maybe you had two. And that's when I was reading the literature, it talked about having two. Um, and and of course, vomiting is a normal reaction to stomach interest, eliminate conscious that irritated. The absence of nausea or retching food parts commonly uh, commonly can result in regurgitation, which is like food backing up to your throat. Small pieces of food in some cases. You have to think narrowing, you think obstruction, you have to think stricture. Again, I said that the esophagus, the mouth, from the mouth, uh, the large tube from the mouth to the top of the stomach, there should be a free flow. There should be no blocks or strictures in there that prevents the fluid. That's why it's important if you're having it to have, get seen, probably get an endoscopy as well as colonoscopy. These are common. They've changed the age for colonoscopy to 45 now, so it's something we should all be doing. Um, and abdominal pain. And there's three types of abdominal pain. There's the visceral pain, and it's pain that stems from the abdomen, from the pelvis, from the abdomen, from the chest, and the intestines, and the intestine activates. In other words, that when you have a pain in the abdomen, it could be coming from the pelvis, from the abdomen, from the chest, or from the intestines. And it tends to happen when organs are damaged. Uh, the visceral pain can be vague, not localized, and not well understood or clearly defined by the patient. It's often felt as a deep squeeze, pressure, aching in the right upper quadrant, liver, in the area of the liver. For example, so it can be in the right according to the liver being descended from alcohol or hepatitis. So there's the visceral pain, there's parietal pain. Parietal pain is pain that's caused by irritation of the nerves that line the portion of the pelvis. So in the abdominal area, those nerves again triggers and tell us that there's a problem with the pelvis or the abdominal cavity. And it can be localized in the skin, and the pain coming from the contract, coming from truly from an organ. So generalized pain versus, it feels like your kidney, it feels like your lung, that kind of thing. And then there's referred pain. This is pain which is located from or adjacent to the organ involved. For instance, a person that only has pain in the jaw or left arm, but not in the chest. Referred pain is described since the late 1880s. Is pain from, if it's duodenal or pancreas, may be involved in the back. If it's from the gallbladder, it can go to the right shoulder. So these are referred pain. Another classic one is the appendix. From the lower down to the lower right quadrant uh, is considered to be pain. Um, I want to thank everyone again for tuning in, for uh, enjoying the show. I want to thank Believe Radio and Isaac Conscious Soul for supporting the program, and I want to thank you as a group for tuning in and listening. We got some real great things planned. I want to thank the community of Conscious Voices, where, and our new member, Dr. Angela Green. I want to thank her. I want to thank Mosey and Cheryl Crawford and all the folks that make this possible. I want to thank everyone who's on the call today. Cheryl, all you guys are special. I want to thank you for taking this journey, all this journey. About 5 minutes left, really about 10 minutes left. And I kind of wanted to thank Believe Radio and their mission statement. Believe Radio is an inspirational radio and content creator station that supports community upward mobility as well as educational media hub in the city of Oakland. No better mission statement as far as I'm concerned. Um, The last few things about GI is a condition called dysphagia. It's a condition of difficulty swallowing food or liquid. This may interfere with a person's ability to eat and drink. Food sticking or not going down, pointing to the throat, tends to be esophageal or pointing at the throat or chest, usually be of esophageal uh, uh, origin. And a problem with both liquids and solids suggests a motility disorder from the two. So we can have a discussion about, again, motility per solid is the ability of the fluid to travel down the esophagus. Autophagia or painful swallowing is not always related to underlying. It is not always related to underlying condition. It may be caused by use of tobacco, alcohol, recreational drugs to irritate the tissues, drinking very hot or cold drink for long periods of time, or swallowing something big or little that sticks, mucosal inflammation, reflux esophagitis, inflammation of the irritation of the esophagus. We talked about that in terms of the pipe that carries food down the throat, and because of the lower esophageal sphincter not being competent, not closing completely, the acid in the food may shoot back up. Another common issue was constipation and frequent and irregular difficult evacuation of bowels. Again, one of the primary issues is diet and food consumption. So constipation is not always related to underlying condition. It may be caused by insufficient qualities of water and fiber in meals, changing diet from abnormal activities, physical inactivity, holding stool for long periods, even with the urge, drugs such as narcotics, antidepressants, and antacids, especially those rich in calcium, um, and narrowing of the stool may be due to a mass in the colon. So you get these stick-like or really slender type stools. Maybe due to, again, get narrowing the stool may be due to a mass in the colon or a stricture in the colon rectum. And the size of the stool may and limits the size of the stool can pass through it. Conditions that cause diarrhea can also cause pencil-thin stools. Persistent pencil-thin stools, which can maybe solid or loose, is one of the symptoms of colorectal polyps or which the cancer. That's why we're doing colonoscopy, so people know. Melanoma. If you're bleeding in your GI tract and your esophagus, stomach, or duodenum, and you have black target through there, that's called melanoma. It can be a sign of esophageal gastric cancers. And again, these are things that need to be checked out. And particularly if you're having weight loss, you're a smoker or a drinker, or even and diabetes, definitely an issue. Diarrhea is a discussion around evacuation in the from a large and small bowel or proximal colon, so again, areas of the colon. Frequent small stools with urgency or defecation at the end of the colon or the left part, again, or left rectal disorder. So either these issues with diarrhea can start in the small and large colon, or they can start in the rectum. And nocturnal diarrhea is always concerning. If you go to bed and you have diarrhea and you can't associate it with, drugs or alcohol or something you ate, you need to have that checked out. Particularly if it's consistently happening. Anything, I think, longer than 3 days that happening, I would want to have a UC by provider. Last thing is changing bowel habits. And it's caused by a range of conditions, and from infection to underlying medical disorder, and this could be chronic but again, the last one is skin changes, jaundice, and again, changing color of skin, and can be hepatitis and gallbladder disease, and got to think about cancer. Well, hey, it's been great. I want to thank you for listening. Again, our lineup as we close out: Believe Radio, the 24-hour inspirational and gospel music channel. The first week is the Eyes of the Conscious Soul with Sister B. Miller. Brings you first Saturday of the month from 2 o'clock to 3 o'clock. And in that time frame, she has Cafe and Blue Lounge in a number of corners. Each corner has a blueprint that is unique in its own, so relax and vibe out the cool sounds, fireside chats inspired by affirmation and inspirational messages. It's a corner of Cafe Blue Lounge. It's the artist talk, the Why I Dream, and She Who takes off the mask. And the second Saturday is 2 o'clock to 3 o'clock, medicine hour. Your yours truly, George Pearson, and my partner in crime, Sister Mello, Barbara Howard. Again, she will be back next week doing educational training. Women's going to be smart as hell. This is where we believe that Billy Bird March starts with us. The third Saturday of the month from 2 o'clock to 3 o'clock, which is the Education of Medicine. I'm the host and founder. I have a 501c nonprofit, charitable organization. It's based in health education advocacy based and a resource based organization. Uses public media sources like this and radio sources. And again, one thing, Believe Radio. And the fourth Saturday is the kitchen table with Miss Howard, Sister, aka Sister B. Mello. I'm founder and producer, and I am her co-host. So I want to thank you folks for listening. I want to thank you for sharing. I want to say to all of you, you are loved. I wish you all the best. You are rare. OG Mendingo, he's a writer I love to. He says, proclaim your rarity. Uh, do everything in love. If someone wants you to go 1 mile, you go 2. In my case, I go 3. I want to thank all of the folks of Conscious Voices for being who they are and moving in this direction. And you'll get to meet the folks in Conscious Voices, a great talented group, and just about us and about our care. I think that it's been great. I want to say thank you to my Facebook family, and please keep the cards and letters coming, folks. Tell me what you think about the single men at risk. I think that was kind of an interesting article. And how does that play off? You know, are the men just whiners or have no soul or what? I do the best that I can. I've got girls now, so I have to kind of be a little bit more understanding and sensitive to hear a lot more. I have a large female population, and I'm still learning. I think it's something that we're trying to learn and try to be better at if we're men. And I think the question was, can we be better men, basically? And if you think you're the best man you can be, then the article wasn't for you. But it was for me because I still want to try to be as best I can a better man. As my father was and his father was before him. Those were my models, those were my images. I want to again thank you for listening, and we're going to close out. Bye-bye.